invitation. So our topic of presentation is passion and profession. Is it contributory or contradictory? So professional career is important for everyone. To excel in one's profession, it's not an easy task. It takes years of hard work, training, practice, perseverance, etc. And it's not an easy ride or overnight journey. So choose a career you love and never have to work. Basically, I was an ENT surgeon in health service department. Then I joined in medical education department. Then before that, I have worked in many departments like surgery, ENT, and even in gastroenterology. I have worked as professional lecturer. These are all beautiful experiences for me as a doctor. So passion is intense love or desire to do something. According to Sigmund Freud, father of psychology, modern psychology, he described the mind topographically into conscious part, preconscious part, and unconscious part. And he described the mind as a tip of iceberg in the sea. Tip of an iceberg represent the conscious part of the mind, and preconscious and unconscious part form the submerged part. So our basic instincts, passion, feelings, then dreams are all lies in your unconscious mind. So you have to, at any point of time, you can recover it or recover it into conscious part and make it real or happen. So my artistic career started in 2010 after the ban of private practice. So I joined in an art school, Contradictory Art School at Kottayam, and I joined as an evening batch student along with the 5 other people. And after 1 year, we have conducted a show called Punarjani, that means rebirth. And then again, after 1 year, then second edition was also conducted in DC Art Gallery, Kottayam. So during this period, I have great opportunity to interact with the great artists of Kerala and sculptures. So that's my artistic experience. So let me show some of my artworks. These are 2 paintings with a soft pastel on paper. First one is, that Christmas night. The second one is, it's like, it's an contemporary art. That means present day form of art. You can draw anything or you can make your ideas or themes into your canvas. The second picture, my title was Bird on the Ventilator. That means a man reading in his room and a lot of knowledge, but he is not enjoying his freedom of life. That's the main theme. Then another unique painting I like is watercolor painting, but it is difficult to do because it needs a lot of practice, because the uniqueness of the watercolor is its transparency. So when you have a mistake or error, you cannot hide it. So I like nature study, then village-scapes, then cityscapes, then another restaurant scene. I don't like to detail everything because just to wash with the colors and just put some strokes with the brilliant colors make a good painting. That's my style of way of painting. So nowadays we can, without brush, palette or paint, we can make important nice painting with newer gadgets like digital painting. And with the digital painting we can insert intense emotions to the characters, and we can put brilliant colors, and it will be very nice. This is acrylic on paper. It is an opaque medium. So the first one is Fisher vendor lady. Then second one is again a contemporary art. So during the COVID time, I was painted this picture, and a man sitting and thinking about and holding a virus and thinking about where to hide and where to bury. And these are all my fantasy and experimentation on digital works. So again, puppets, clown. Then every time we need not tell a story behind a picture, because how do you read a painting? By frequently seeing paintings, you will have a visual habit of reading that. First picture, a group of people are trying to say something. I don't know. You can work it out. Then another type of painting is signs and symbols can be used as a nice painting. Then again, this is my digital fantasy. It's again the Christmas Monday, Thursday and Good Friday. Digitally I have done in my mobile. This picture, the first picture, I was inspired from the photograph during the COVID time and the burial ground. And another, in digital painting, we can do lot of experiments and creativity. With instead of canvas, I am using the paper behind it, the newspaper behind it, and you can draw any picture and convey some ideas. So another form of art is abstract painting. You can use some forms, lines, dots, and all can form a category of art that's called abstract work. I like also. These are abstract works. These are on oil pastel on paper. And during COVID time, I had done a lot of works done and was appreciated by the media people also. Then cartoons are another artistic vehicle characterized by metaphorical and satirical language. We can use animals, birds, or insects. Even inanimate objects can be used to tell a statement. Then during the after Nipah, at the peak of COVID time, the cartoons are a very important media to communicate with the people. So this was also widely circulated in social media, and that was recognized by the media person also. And during COVID times, every news can be were the thread for a cartoon work. So to conclude, nothing is as important as passion. No matter you want to do with your life, be always passionate, also be professional. Thank you.
Which has been allotted for me is passion and profession, contributory or contradictory. When Mahadevan sir and Mini gave me this topic, initially I was a bit confused, like, how will I do a PPT on continuing your passion and profession? Then I went and searched in the dictionary what is the meaning of passion exactly. So it is an intense desire or a strong liking or a devotion to a particular object or an activity or a concept. And in Malayalam it means abhinivesham, adiyaya agraham, that is passion. So each person will be having a different passion. It will not be same for me and you. So what are the fields of passion? It can be in sports and fitness, music and dance, creation and arts, books and writing, photography and film, nowadays social media vlog, community service, designing and stitching, gardening and cooking, adventures and travel. And some persons might be having a rare passion which some of us feel awkward. One of my friend's husband, he's a leading gynecologist and an infertility specialist working in Kerala. His passion is bird watching. So whenever he gets time, he takes a break, goes into the forest along with a guide, takes pictures, spends hours and hours for this bird watching. And now he has started writing authentic vlogs about bird watching. So it differs for each person. Now, passion can be either harmonious or obsessive. When it is harmonious, your passion is contributory to your profession. That means to break the routine work, food, bed cycle, when a person goes into his passion or does his passion, there are psychological benefits. It benefits your physical health. You get appreciation from your peers. It can be a source of income for many. You develop new skills. Definitely it boosts your self-confidence. You can concentrate more. And finally, you enjoy the process. And when does it become obsessive? That is when it becomes time-consuming. You do only your passion, not concentrate on anything else. It becomes an obsession when it affects your physical and mental health. Your personal life is affected. Professional life is affected. It becomes quite expensive, and you're burnt out of energy. And you're obsessed on the outcome of passion. If your passion is harmonious, as I said in the previous slide, you will be never obsessed on the outcome. So this is not a new topic, like continuing your passion and profession. It has been there since many years. Like most of the old persons also had continued both their profession and passion. Let me mention some of them. Who is this? Charles Kellman. He is the father of phacoemulsification. So in his childhood, he wanted to become a world-famous musician and a saxophone player. It was his passion. As we all know, in Western countries, it's like the children have the freedom to select whatever they want. If they're interested in sports, if they're interested in music, they can go in for that. Not like a typical Indian scenario or a typical Kerala scenario, where if you're above average in learning, the first two options are medicine, engineering, then only the other options comes. But unfortunately, Dr. Kellman's father was a typical Mallu in his character. He wanted Kellman to become a doctor. So he told, no music, nothing. You study, you become a doctor. Ultimately, he had to become a medical graduate. Once he completed his graduation, he thought of selecting ophthalmology for his post-graduation because he thought he'll get some ample time to spend for his passion. He wanted to continue music. So after 2 years or more of hard work in the field of phacoemulsification, he could finally popularize it. In the initial periods, there was a lot of criticism all over the world. And what he did in the initial period was, he used to give training to the young doctors about phacoemulsification. And at the end of the session, there would be a cultural show where there was musicians participating. And Dr. Kellman himself would perform on the stage with other artists. So this beautiful story of Charles Kellman is given in our own journal, KJO, I think January edition, and it was written by none other than our beloved teacher, Dr. Biju John. I think most of you might have read it, but those who have not read it, please go and read. He has written it in an amazing way. All his sense of humor has been incorporated into that article. So it's very interesting to read that. So finally, he became an excellent personality in the field of ophthalmology. He got all sorts of awards, everything. And at last, he started performing stage shows, and he started sharing the stage with world-famous jazz musicians and artists. So he's a person who continued both his profession and passion and excelled in both. Now next, the first person is none other than Arthur Conan Doyle, the creator of Sherlock Holmes, and the second person is Robin Cook. Both of them were physicians, and they practiced ophthalmology also. Now coming to the Indian scenario, Dr. Professor Daljit Singh, he was a famous ophthalmologist, and he used to write poetry also. He has published many poems which has been translated into Hindi, Urdu. And now, how to find out your passion? It's nothing like you have to go behind so many things and find out, oh, whether this is my passion, nothing like that. The passion is inside you. It is inside you, you have to find out. And what I feel is that you have to get exposed to multiple things during your childhood days itself, so that you can identify what gives you ultimate happiness, doing what makes you happy at heart. So that is how you identify the passion which is hidden in yourself. And passion, for sure, it provides self-relief. It creates better self-esteem, and it creates resiliency. But one important thing to note is that while doing your passion, it doesn't mean that you should become ultimate in that, or you should receive some awards for that, or you should get a recognition for your work. Why you are doing passion? Just for your mental satisfaction, just for you to be happy. When I dance on stage, I definitely know that I cannot become a Padma Subramaniam or Alamirvalli or internationally renowned artist. But it is for my satisfaction I dance. So the ultimate thing is that you should be happy. When you do your passion, you should feel like, I'm fulfilled. I'm fulfilled at heart. I'm happy at heart. You should not aim at some award or something when you do your passion. That is an important thing I wanted to stress. And since I do dancing, I like to tell some positive or some advantages of dancing. Through many studies, it has proved that apart from keeping you physically fit, dancing also improves your mental health. So it improves your mood, it eases depression, lowers anxiety, it improves your self-esteem, and lessens loneliness. And when you dance in a group, like when you do a Zumba dancing and all, the advantage is that you get more happiness or more, more fulfillment than you do it alone. So studies have proved that that is because you share a feeling of friendship, or you have a bonding with others when you do a dancing in group. So that is why most of the persons who have not learned dance during their childhood days, they enjoy Zumba dancing. And for me, luckily, I started dancing at a very young age, only because of my parents, especially my mother. My mother took me to a dance school, Regatta, run by Srimati Girija Chandran, when I was around 3 years of age, when I showed some mudras or some poses and all, hearing a song in the radio. Even I don't remember what I danced at 3 or 4 or 5 years of age, but I enjoyed going to dance classes after completing my school, after completing my academics, and then I enjoyed dancing with my friends, be it a program or in a dance class. I was happy whenever I was dancing during my childhood days. But after some age, there was a break. As you all know, a break will happen in any, especially a female's life, because you have to give importance for your family and all. So there was a break. After that, I started dancing again. I had gained a lot of weight, so I had to reduce it. Then only you can enjoy dancing. Otherwise, it will become a burden, like you will get tired all of a sudden. You cannot enjoy it. So then I reduced weight, then I started dancing again. So now I feel it as a thing which makes me move on. So the attitude which I had towards dancing at my younger age and this age is totally different. So I think your passion also has got a different dimension at different age. So last day when I was talking to one of my old friends, he's my schoolmate, and I was telling him I'm having a presentation like this, passion and profession, contributory or contradictory. Then we were discussing about that, then he asked me, so let me ask you one question, Arya. If dancing is your passion, then why don't you go into that 24 hours? You said dancing gives you happiness. Be happy all the time. Dance, dance, dance. Why are you taking ophthalmology as your profession? Then I thought, and then I answered, I wanted to become a medical professional. So I enjoy doing ophthalmology also. It is not like your profession is solely to get an income. You enjoy your profession, but I like dancing, I like acting. So everything is a sort of passion. Multiple passions can be there. And while I was preparing this PPT for my presentation, my son came and asked last day, Amma, what are you doing? Then I told, I have got a PPT. It is for Rioalumni Association. This is a topic. Then I told him what is passion. I gave him all the explanation, what I'm planning to do, everything. Then he listened to me, okay, all the best. Then he went away. After some time, while I was doing my household works, I finished everything and went, and he was watching TV. He was lying in the sofa watching TV. Then I asked, there's a long time you're watching TV, go and read books or you go out and play. Amma, I have understood that lying in the sofa for a long time and watching the TV like this, it is my passion. It gives me a lot of happiness. Nothing else can give me happiness like this. So at that stage, I had to behave like Dr. Kellman's father itself. So this was an album which I did last October along with the playback singer, Akila Anand. And this was a performance I did along with Dr. Anita Uni. She's also an ophthalmologist. She's here for our own KSOS conference, but unfortunately it was an online program due to COVID restrictions. So another thing what I would like to tell is that when you are in a group where you see people who promote your passion or whatever you like, you will have a much more drive to continue it. So a few months before, Dr. Natasha messaged me saying she's planning to start a group of female ophthalmologists, and shall I also add in your group? Then I thought, oh, again, once more WhatsApp group, lots of WhatsApp group are there, family group, school group. Okay, then she's asking me for the first time. I have not met her personally. Then I thought, okay, I'll agree. Okay, madam, I'm ready. I sent her a message. And she added me to that group. It is a group of lady ophthalmologists. Many of the members are here. It is called V. But to my surprise, that group, it is a different group. It comprises only of lady ophthalmologists working in different sectors. So each of them will post pictures of either cooking or interior decoration or gardening or music or dance, whatever they do. So what I feel is that when you are in a group where you see people working in your same profession, all of them are ophthalmologists, most of them are working in private sector, running their own clinic, working in government medical colleges, private medical colleges. They are all occupied. They are not people who are sitting idle in their home. So when you see such a group of people doing so much of activities amidst their busy profession, you also get a call like, oh, if these people can perform like this, why can't I? I also like these things. So let me also do these things. So being in a group which makes you active is also equally important. So that is where I identified this person, Dr. Juni. She is an ophthalmologist working in Gujarat. She does phaco surgeries. She's a dancer and she's an excellent artist. Her pictures are full of life. So enjoying her pictures through this V group also gives her positive energy. Another person I have not included in her slide is none other than Dr. Natasha. I had asked her for pictures. Then I thought she's coming here. Why show her pictures? I have actually wondered, is there any field she has not tried? Academically excellent. Then what tip you don't ask her about makeup, about fashion, about gardening, about interior decoration. Everything she'll give you expert advice. I have not included a picture purposefully. And this V group also was her idea. And this is another person whom I have not met yet, but from the V group only. She is Dr. Preeti Prashant. She has undergone through many hardships in her life. I don't want to specify each, but she is a person who has undergone so much of trauma in her life. But every day she posts a lot of pictures, be it her garden, about her cooking. She may post her songs after singing, everything she posts. And I think her passion is to keep others positive. She radiates a lot of positive energy. So that can also be a passion. Yes. I have not met her. Yes. So this is Dr. Ramya. She is also an excellent artist. Many of the, it is not confined to 3 or 4 people I have shown here. There are a lot of ophthalmologists doing their passion, but it is impossible to incorporate everyone into this presentation. So be it your passion, but never be over-obsessed into it. Like they say, workaholism and alcoholism both are detrimental. You keep everything in a balance. So 3 important things for you to continue your passion and profession simultaneously is, one is time management. Rather than time management, I would say prioritize your needs. That is the most important thing. When you have to spend time for family, spend it. Don't think about dancing at that time or spending time for passion. That will only irritate your family members. So you want your family also. So prioritize your needs. And another thing is that even if you, what I have felt, I don't spend an hour every day for dancing and all. I don't know whether it is possible, but I spend some hour frequently. And what I think is that every person, be it a woman or man, they should spend some time for themselves every day or once in 2 days. That means at that time you should be a little bit selfish. That is what I will tell. You should spend time for yourself, either it be hearing music or relaxing or meditation, whatever that gives you happiness. So that selfishness will in turn make you happy. And when it blends, this mission, vocation, profession, and passion, everything it blends, it becomes a masterpiece and it serves a purpose. And another thing is that As the previous speakers has told, always you need a family support for continuing your passion and profession. It is nothing like you are a superwoman, you can do everything, no household works or anything. And I think it is more important for females, because compared to males, females also always have an additional burden of job. Because I think most of you will agree to that. Exceptions might be there, but OP-യിൽ ഇരിക്കുമ്പോൾ നമ്മൾ ജോലി ചെയ്യുമ്പോഴും എല്ലാം വൈകുന്നേരം ദോശ വേണോ ചപ്പാത്തി വേണോ എന്ന് ആലോചിക്കാത്ത ഒരാൾ പോലും ഇതിൽ കാണില്ല, females. But males are not concerned about that. That is an additional advantage these males are. Exceptions are there, but I still say. So when that thing comes into your mind, yes, you will have to compromise something. So that is there. And so family support is very much important. And the third important thing is your health. As doctors, everyone say doctors are the worst patients. We never give importance to our health. If health is not there, no passion, nothing. So always take care of your health. And recently I got a chance to act in a movie called Vashi. And now it is being streamed in Netflix. So if you get time, please do watch. And it was again a wonderful experience to work with all those artists. Thank you.
Due to cerebral pathology, a bilateral visual impairment in the presence of a normal ocular examination, subnormal visual performance with or without normal visual acuity, in the presence of damage to early processing in the occipital lobe or in the visual association areas. By definition, it's a verifiable visual dysfunction which cannot be attributed to disorders of anterior visual pathways or any potentially co-occurring ocular impairment. That is a definition by Saki. To understand CVA, we should have a thorough knowledge about the visual pathways. So let's start with the question, how does the brain see? We all know the photoreceptors in the retina convert light energy to nerve impulses and through the lateral geniculate body reach the occipital cortex. Early processing takes place in the occipital lobe for visual acuity, color vision, contrast sensitivity and visual field. The processing of motion perception takes place in the middle temporal lobe. After the early processing, the visual information goes to the temporal cortex. That is the visual library where the images, all the images you have seen in the lifetime is stored. And the information also goes to the posterior parietal lobe. That is the visual map via the dorsal tract. I'll give you an example. This is a pen. So if I have seen this pen before, my temporal lobe will help me to recognize this pen. The color, there is a blue color, and this is a pen. This is by matching with the images stored in my temporal lobe. Okay, so to take the pen, how my fingers should orient to take the pen and how much effort, how much force should be used. All this is decided by the parietal lobe. That is the visual map. And then the fibers impulses goes to the frontal lobe, and frontal lobe will decide whether this is my pen, whether it is appropriate to take the pen. Once the frontal lobe commands, the motor fibers, the impulses goes to the motor system, and my fingers come and take the pen. Vestibular system and proprioceptive system also have some role in this process. All this happens so synchronously that we don't realize that this is such a complex process unless they are affected by some pathology. Why I am explaining all this is what is affected in our CVI children. So in CVI, so these children are at risk. Cerebral palsy, premature birth, hypoxic ischemic encephalopathy, infections of CNS, hydrocephalus, neonatal hyperglycemia, all these can have CVI. So how will you differentiate cerebral visual impairment from ocular visual impairment? As I told you, the eye will be normal and ocular findings will not explain the visual loss. And naturally, the treatment to the eye will be suboptimal. And the dictum in CVA is visual behavior may vary. It may vary depending on the child factors and environmental factors. Like child factors, whether child is fatigued or sick, or the environment, if it is a crowded environment, whether in the OPD, it is the vision will be very low. But in a CVA clinic, whether child is isolated and whether child is in a happy mood, then the vision will improve definitely. So that is a dictum. Then there will be a traumatic perinatal period in CVI. Latency will be prolonged and visual attention will be short. All this will be normal in ocular visual impairment. So CVA is a clinical diagnosis. Basically, it's a clinical one. If there is periventricular leukomalacia in MRI, it may support the diagnosis. And you have to be very careful. Normal MRI cannot rule out CVA. This is a very oversimplified classification. There are a lot of classifications for CVA. This is depending on the brain, whether it is affecting all the three parts of the brain, forebrain, midbrain and hindbrain. In number 1, CVA with profound disabilities, cognition, mobility and vision are affected. It's like global developmental delay. We all see such children. There, all the three parts are affected, forebrain, midbrain and hindbrain. In CVA with disabilities affecting movement and speech, that is, example is cerebral palsy. Here, only midbrain and hindbrain are affected. Not in all cerebral palsies, because in cerebral palsies, intellectual abnormality also may be present. CVA with, third one is CVA with no other challenges, only CVA, that is hindbrain only affected. Actually, CVA is a spectrum of disorder from low functioning CVA with severe visual impairment, profound CVA, to high functioning CVA who can see but cannot process. Such children, such high functioning CVA children will not come to ophthalmologist directly. They will be branded as learning disability or attention deficit disorder or MR, mentally retarded. So such children also may be having this processing disorder. Behavior is typical to children with CVA. Variation in visual behavior I told you, there are depending on the environment and the child factors. And vision loss from mild to severe, visual field defects will be there. Lower field defects are very common. Sometimes hemianopia also can be there. Color may appear washed out, or color preference may be red or yellow. Some children can have color preference also. Face or facial expressions may be difficult to recognize. Sometimes face recognition also will be difficult. Difficulty in recognizing shape, letters, numbers, line, direction and length. So in such children, school will be very difficult. Like if you can't understand the difference between plus and minus, maths will be a nightmare for the child. Route recognition may be difficult. Maybe daily going route to the school, but child may not be able to recognize the route. Poor performance in cluttered environment, especially in crowd. Usually, child may use tactile clues to identify the object. This is the lower field effect. See, with the same visual acuity, poor contrast. It's very difficult for the child to recognize the face with this poor contrast. And this is simultanagnosia, limited capacity to pay attention to several details of the scene. It's difficulty in putting together and seeing the whole image simultaneously. It's not about the size, color or contrast. It's about what is important and interesting to the person at the moment. To the same child, it may be different in a different atmosphere or at a different point of time. So it's very difficult to understand. See, this is a picture of, this is all from CVA Scotland using side sim. Optic ataxia, there is impaired visual guidance of movement through visual world. Apraxia of gaze, difficulty in finding things, that is look at things someone else has pointed out. All these three symptoms, simultanagnosia, optic ataxia and apraxia of gaze, this dorsal stream dysfunction has all these three. and usually it may be associated with lower field effects. Sorry. Child with low functioning CVA becomes aware only when surrounded by a tent. We have seen a lot of children like that, profound CVA. They will not be, thank you. So I'm coming to such children later. Crowded places may be frightening, and this looming is a very frightening symptom. Fast moving things may not be seen or may appear to be on collision course when actually they are not. When child may be near the road, through the road a car is passing, child may have a feeling that the car is coming towards it, and it will be a frightening experience. Child will be screaming. Eye contact will be abnormal. Child may seem to look at the hairline. A child usually has less than 1/3 of 60 to 80 typical visual processing function. Every child with CVA has their own unique pattern of vision. Every single component is affected in different proportions and different degrees in every single child, like a kaleidoscope. Each time when you shake, you will see a different picture. Our aim is to find and to know the limits and staying within them using alternatives, extend the limits. The approach should be a transdisciplinary one. And in the first visit, you should establish the diagnosis, whether it is a OVA or a CVA. Or in CVA child also, you can have some ocular pathologies. So second thing is eye evaluation to look for any treatable ophthalmological problems. Child should be comfortable either in lying down position or sitting, well fed and rested, in a quiet room, not in the busy OPD. First, rule out ophthalmic causes like cataract or strabismus or refractive errors. Do a dynamic retinoscopy to look for hypoaccommodation. Hypoaccommodation is very common in Down syndrome. Then in such children, you can give +3 correction. Then give appropriate refractive errors. Refractive errors also, around 60% of CVA children can have refractive errors. I'm sorry, I have a bad cough. And just want to say a few words about counseling. See, these parents, they would have heard, they'll be tired of hearing, eye is okay, brain is abnormal, like that. So they'll go from clinic to clinic. So what we in our CVA clinic, what we do is, we tell the mother or parents that you should know how the child sees. Then only you will be able to help the child by giving suitable environment for the child. Because the defects we are not going to change, but we are arranging suitable environment. Like for example, if contrast sensitivity is affected, you can give felt tip pens, and you can arrange arrange the room in such a way that contrast sensitivity is more. Contrast is more. So like that, in every situation you should know. And we should also tell the mother that you are the person who is going to give the vision therapy, the training, by arranging suitable environment and by infusing vision in day-to-day activities. That is, so 24 hours the child is getting vision therapy. And also tell them about the neuroplasticity. And tell them that in every difficult situation, we are here to help you, but you should take the control. They should not think that, okay, this doctor is going to give some medicine, something like that. It's not like that, it's the therapy. And you should make them aware the child's condition. And the evaluation part, I think the time is over, so I'm not going into the detailed part of the evaluation. Okay. So this is our, okay. Okay, I'll keep it. അല്ല അത് കുഴപ്പമില്ല. This is our CVA clinic. It's a clutter-free environment. It's not like our busy OPD. Just want to show the clinic. And we give a structured inventory. This is Dr. Dutton's inventory, and I have translated to to Malayalam. And actually, there are different types. Around 50 questions are there for children above 2 to 3 years. Like this is just to prevent omission. They can the complaints they will be telling. The first thing is facial communication distance. The facial communication distance we should know either by mirror test or by just by going near the child, because all the communication given to the child, it should be within that distance. That we should tell the mother. This is Leah gratings. With this you can assess the threshold of line thickness. Then explain to the parents the line thickness the child could appreciate compared to their own fingers, so that they can, in their life, they can manage. And this is contrast sensitivity. This is, see the child, when the child responds, even the pre-verbal child responds with a social smile. This is testing visual field, latency, span, then pursuits and saccades. All this should be tested. Then cognitive visual assessment also will be there, should be there. See, this is, this child cannot understand shapes, recognize shapes. See how she is putting it? She can't recognize, and she can't put it correctly. And this is a mailbox test. See, she is taking this tactile clues. She is taking tactile clues. So that is the cognitive test, and child may not be able to recognize the expressions. Then visual closure may not be there. Then intervention. It's not a passive process, it's a dynamic and interactive approach. Instructor chooses specific meaningful stimuli found by assessment, makes adjustments while looking at the reaction of the child. Should be carried out within the context of major developmental activities like play, communication, movement, and learning. Child needs support to recruit this and use visual system, because this does not come natural. So at this point, child needs support. That is the point I wanted to convey. So to the parents, you should tell them. Once you assess the child, you should tell the parent about all this. Then there are 2 challenges: helping a child to use available vision, and then helping the child to understand what is seen. So according to the visual processing disorder, you can use, there are several apps are also available for a warm-up session, but ideally you can use live situations, daily life situations for vision therapy. You can enhance the facial contrast by makeup. Then always stay within the child's visual sphere. Then speak softly and clearly with gaps. Slow speech therapy, that is, Dr. Dutton is advising slow speech, because child cannot comprehend if you speak in your your speech, that fast speech is not, the child may not be able to comprehend that type of speech. So always monosyllable. You should tell them, when you show up on one ball, you can tell them, Panda. That time, child takes that time. Then only it will understand. And always when you show the object or you do an activity, you tell the child that name of the activity or name of the object. So when you repeat this, child will be able to understand. And then it will start speaking. Speech is very important in the case this. And always use radio language, unlike TV language. You can understand the difference, no? Infuse vision into daily routine. This is the, this is what we do in a profound CVA child. This child, without eye fixation or following social smile, nothing, no developmental milestones. See, in a tent, you are showing this toy with auditory and tactile elements added to it. With this, child is responding. So this is the starting point to arouse the visual curiosity. Then slowly, when you get a visual information, child will start visual discrimination, and then slowly this process of vision starts. And there are many strategies for visual rehabilitation, but always remember there are 3 key rights: right to learn, right to independence, and right to effective social interaction. CVA can be very disabling, but trainable. With the right training at the right time, their skills can be enhanced. Thank you for patient listening. If you have time, I have a simulation about CVA child's vision. This is sent by Dr. Gordon Dutton. Yeah, this is 6 minutes video. See, this is actually audio. ഇതിൽ കൊടുത്തില്ല, അല്ല ഇതിൽ കൊടുക്കായിരുന്നു. അത് മറ്റേ വീഡിയോ.
Then use a photo of anything in their world to find out how this looks different owing to that child's measured level of reduced visual acuity and contrast sensitivity. What does their teacher look like? What does their home look like? And what does their lunch look like? These children also would most likely have reduced vision in the bottom half of their visual field, and for some, this will be severe, meaning that they have no vision in this area, as we are showing here. To help these children, things need to be bigger, bolder, and higher up to be seen. But even when we do this, many affected children still have profound difficulties learning through vision. But why? With our current understanding, we believe it likely that many of these children have an additional visual impairment that can go unidentified and so not supported, and that these may be causing some of their learning difficulties. These are deficits in visual attention due to dorsal stream dysfunction affecting the posterior parietal part of the brain, as explained in our short film.
The first film shows a person moving across a clear, open beach. Vision appears almost typical until the people and their dogs come into view. Then how much can be seen reduces. They can see only 1 or 2 things at a time, with the peripheral visual world disappearing and the central window of sight narrowing and fluctuating. Once the complexity of the visual scene reduces and the people and dogs are left behind, and back into an open landscape, the visual experience becomes more typical.
This fog and window effect you are now seeing in the classroom is the same effect as seen in the beach video. We are learning from affected adults who can tell us that this type of vision is dynamic and constantly fluctuating. Where there's distraction from more noise and movement or clutter, taking up more of the brain's available mental processing power, the smaller the window of vision becomes, meaning that the child's ability to give visual attention can become much worse. Our computer program has been created to emulate this visual phenomenon by automatically decreasing the amount that is visible when the clutter increases, and the opposite in reverse. Recent research is identifying another group of children likely to be affected in this way, those in special schools with learning difficulties, including some with autistic behaviours whose visual acuity can be typical. It has been estimated that in mainstream schools, at least one child in every class is likely to be affected, but to a lesser degree. There are, of course, other children who are affected who do not fit into these specific groups. Some affected children are academically gifted, but the majority struggle at school and socially. How can we help? I'll show you. This is another of our rooms. Everything is one colour, orange, and there is only one thing to see, a large blue ball. The dorsal stream dysfunction program is running, but where's the surrounding fog and the central window? In this environment, with no clutter to cause vision to narrow, and only one thing to see, the window of vision stays wide, just as it did on the beach, meaning that the child can see more and make more sense of their world, and in this case, learn what a ball is. All such children benefit from an uncluttered environment to live and learn in. What might it be like for the child with additional reduced visual acuity and the other visual impairments? Let's take a look at them all together. Sometimes things are visible, sometimes not. How can the child piece things together when sometimes only parts of some things are available to see? Nothing makes sense. We have separated the video with the dorsal stream dysfunction filter and put it into a separate box, top left, to show you the different visual impairments together. But children with CVI can't do that. They have to live with all these visual difficulties combined all the time. No wonder learning is difficult, and from many accounts, these children easily become overwhelmed, often choosing to close their eyes. Let's see what happens if we move this child into the orange room. The ball is still visible when high because it is big enough, bold enough, and with no clutter, the dorsal stream dysfunction has naturally diminished. In this environment, these children can and do learn, and we know this because parents and teachers who have tried it tell us that they've seen remarkable benefits. Looking out for and profiling each and every one of these visual issues and taking them into account can transform lives when appropriate action is taken.
It is when there is no clutter, the window will be larger. The child will be able to appreciate things better. Thank you for patient listening.
Thank you, madam, for the beautiful presentation.